Greetings everyone, my name is Mpho Ngoepe from Nelson Mandela University in South Africa. Today I'll be talking about the future of nanomedicine strategies for artificial blood production. So in this presentation, I'll be focusing on a little bit of history of what is blood transfusion and also who are the people receiving blood that is donated. And I'm looking to the issues of blood supply, looking to biocompatibility issues, and then I'll give a little bit of introduction on what is nanomedicine and its application in artificial blood, and I'm looking to different products that are actually nanotechnology for design of artificial blood, and also look into the complication caused by these products. So briefly looking into the history of artificial blood, we can see that in 1628, it was when it was discovered that within blood actually circulating. And then from there in 1818, this is where the first experiments of blood transfusion occurred, which occurred between a dog. And then you can see that this later led to human blood transfusion. And then in this is where we first discovered three types of blood groups, A, B, C, and then C was later renamed to O. That's when the type O was designated as a universal donor. And then in 1948, the American Red Cross began the first nationwide blood civilian program. So after the blood is being donated, we can see in this other figure that 34% of people who are receivers for the donated blood is actually cancer patients. This is followed by people who are suffering from anemia, those undergoing surgery at 18%, those who are going for dialysis for kidney, it's about 13%. And then you've got 10% for orthopedic, 4% athletic, and then 2% for trauma and road accident. So in terms of the blood supply, you can see that first of all, we get the blood from the donors, from the vein, and then we put the blood into blood bags, and then it's transported into laboratory for testing. So the issue with the testing is that most of the regions, such as India and South Africa, actually have a high rate of HIV. So even though in figure 2, we can figure 4 that we can see that actually a high number of people are willing to donate blood. Sometimes the blood actually is not safe because we've got STD that can actually be circulating in the blood. The other issue also is that even people with cancer, when they donate blood, sometimes their antigens can actually be present in the blood. So when we're looking into blood compatibility, we can see in the figure on the left that actually we've got different type of blood which are rare, with AB minus being the most rare at 1%, and then O plus at 8%. So in terms of the donor recipient chain, you can see that AB plus can only donate to AB plus, and then O minus can actually be considered the universal donor, which is followed by O plus. If a patient was to receive the wrong blood group, we can see that those complications that can occur can range from fever and chills, breathing difficulties, muscle aches, nausea, chest, abdominal, and back pain, blood in urine, and jaundice. In terms of nanomedicine is just the application of nanotechnology into the field of medicine. The application of nanotechnology in the field of medicine can actually lead to better imaging for tumors, that you can see in the figure here for imaging. And then you can also use it as a drug delivery system. You can target different regions of the body by delivering drugs to those specific regions. You can also design scaffolds such as nanofibers, so you can actually be able to create a new skin, cartilage, even bone. So the benefit of nanomedicine, you can see that we've got different main features such as increased shelf life, increased drug viability, boost stability, even encapsulation, targeted therapy, reduce immune recognitions, reduce medicine degradation, increase solubility, targeted drug delivery system, and ease of absorption. So in terms of application into the field of blood transfusion, at the moment, red blood cells can be stored in a refrigerator at 60 degrees for 42 hours. So by means of integrating with nanotechnology, you can actually improve the storage conditions of these red blood cells or the components, which is hemoglobin, to a longer storage duration. So in terms of the boosting of stability, when the blood is actually stored, the red blood cells can actually last over time. So by incorporating nanotechnology, you can actually prevent the cell membrane from actually getting damaged over time. And in terms of hemoglobin, the problem with hemoglobin when it's actually circulating within our bodies with the help of enzymes, you can actually prevent autooxidation. But the problem with the enzymes are not there. The hemoglobin can undergo autooxidation, which actually leads to production of free radicals such as superoxide. So through the incorporation of nanotechnology, you can actually be able to reduce the production of this superoxide free radical. In terms of biocompatibility, as we have discussed earlier with the different types of blood groups, with nanotechnology, you can actually make sure that the antigens that are actually present on the surface of the red blood cells, which can actually be recognized by people of different blood groups, can actually be covered by using liposomes so that the body can actually not be able to determine that this is the wrong blood type, which can actually help us to make a universal blood donor. So in terms of oxygen therapeutics, we can see we've got different types of oxygen therapeutics, mostly focusing on hemoglobin. We can see with a cellular, we've got your red blood cells, which can actually be fractionized from your whole blood that is actually donated. And then from the red blood cells, we can get hemoglobin, which is the main component for oxygen delivery. So this hemoglobin can also be polymerized, cross-linked, or conjugated. Some of the products that are on the market or even discontinued, we're actually using these processes. And then we've got cellular hemoglobin, where you actually encapsulate your hemoglobin into liposomes or even polymers. And then we've got your fluorofluorocarbon derivatives, which is just basically a carbon chain with fluorine groups, which can actually be used for oxygen delivery. So there's another research that has been done, which is focusing on stem cell research, where we can actually convert the stem cells into red blood cells. So this is some of the study that's actually being conducted in the UK. So there's actually some promise into this research, even though some of the costs might be a little bit more compared to just using hemoglobin or the fluorocarbon. So in terms of perfluorocarbons, we can see that perfluorocarbons are actually stable and inert molecules that are structurally like hydrocarbons, where fluorine replaces most of the hydrogen. So the problem with this PFC is that they actually inhibit intracellular energy generation by interacting with the mitochondria. So these are some of the products that have actually been researched, clinical trialed, and most of them actually failed. The problem is that some of these projects actually lead to cardiovascular problems. So some of them can even lead to causing pneumonia. So only one that is actually approved in Russia and Mexico is perfluoroalkyl. So in terms of hemoglobin-based oxygen carriers, we can see that this is actually considered as a universal oxygen carrier. So this can actually be used to help with people who are going through trauma, accidents. Some of them were actually facing anemia. So, but the problem is that these particles also are actually failing to get into human application. Only Mpho is the one that is actually being used in South Africa, but it's actually been targeted for removal because it actually causes jaundice, hypertension, and can also lead to cardiovascular problems. The only product that is actually available is the one that is used in Europe and the United States. It's actually limited to veterinary medicine. So the problem with hemoglobin-based technology or artificial blood is that the problem with cell-free hemoglobin is that it can actually interact with nitric oxide, which can actually lead to viscoconstriction. And the other problem is that the ion within the hemoglobin can actually undergo oxidation, which I've discussed earlier. So this can actually lead to damage of the lipid membranes. The other problem is that the cell-free hemoglobin can actually lead to endothelial injury. So overall, these complications can actually lead to organ dysfunction and ultimately lead to death. So therefore, it's important to know that hemoglobin is actually not protected by some form of membrane, can actually interact with different molecules within the body, can actually lead to further complications, which is what causes limitations of hemoglobin. But one of the products that is actually easy to design is actually called oxygen nanobubbles, where you actually can create entrap oxygen within a bubble, like the normal bubbles that you can actually blow. So you can either use lipids, you can actually also use proteins or any polymers. So one of the products that has been accepted for commercial use is called Albumix. So as we've discussed with a little bit of issues of what happens with hemoglobin that is not protected, so you can see that one of the issues that it can actually lead to toxicity to the renal system. It can lead to immune system inhibition, as we can see with perfluorocarbons, where it actually leads to causing pneumonia. We also have increased pulmonary and systemic blood pressure. It can lead to cardiovascular diseases. We also can have gastrointestinal irritability, insufficient blood supply to the tissues. So most of the artificial blood products is that they don't actually mimic the actual red blood cells other functions such as transport of nutrients or have any coagulation or immune response features. So with nanotechnology, we can actually be able to actually take different components of the red blood cells that are actually there and incorporate them into a final product that can help actually be designed as a hybrid. So in conclusion, blood substitute belong to the universal blood group O negatives. They can be given to patients regardless of their blood type. So one of these main features is that most people who actually don't want to get blood transfusions for religious beliefs can also benefit from blood transfusion using artificial blood. And also it eliminates the risk of actually getting infection from donated blood, especially if proper tests are not done to confirm that the blood is actually safe. And the other benefit is that with artificial blood, you actually don't need refrigeration. You can actually lyophilize the powder and then leave it into normal room condition. And then when you're ready to use it, you can actually resuspend it into saline solution and then inject into the patient in order to deliver the blood into the patient. But one of the issues that we need to further research is the nanotechnology toxicity concerns, which actually is a main concern that is actually need to be evaluated long term. So this is my reference, and thank you for listening to this presentation.